Hello everyone. Topic for today's discussion is skin disorders. I'm Mrs. Jansi, clinical instructor at M College of Nursing. So the objectives are the learners will be able to identify the skin disorders and the terms used to describe the skin disorders and would know the skin disorders. Introduction. So the skin disorders vary greatly in symptoms and severity. They can be temporary or permanent and may be painless or sometimes painful. Some have situational causes while others may be genetic. Some skin conditions are minor while others can be life-threatening. So as you see here, there are many routes of infections. They are primary and secondary infections. So here in primary infections, it is caused mainly by a single pathogen and which usually affects the normal skin and causes impetigo, folliculitis, and boils. These are the common types of primary infections. The most common primary pathogens are Staphylococcus aureus, beta hemolytic, streptococci, and corniform bacteria. These organisms usually enter through a break or cut in the skin. So then the secondary infections. Secondary infections occur mainly in skin that is already diseased. Because of the underlying disease, the clinical picture and course of these infections vary in vast. So what are the skin infections? Skin infections are mainly by Staphylococcus aureus, as I told you earlier, and they are bacterial fungal infections that is of direct or cutaneous disease or the secondary infections. So under direct infection of skin and adjacent tissues, we have impetigo, eczema, folliculitis, furunculosis, and carbuncle. Under cutaneous disease due to the effect of bacterial toxin, which causes staphylococcal, scalded skin syndrome, toxic shock syndrome. The skin infections caused mainly by group AB hemolytic streptococci. They are the direct infection of skin or the subcutaneous tissue. By Staphylococcus aureus is affecting the adjacent tissues, whereas group A beta hemolytic streptococci will affect the subcutaneous tissue, which is of impetigo, non-bullous and bullous type, eczema, cellulitis. And the secondary infection is known as eczema, which is also known as atopic dermatitis. So as you see here, impetigo. It is initially a vesicular infection that rapidly evolves into pustules that rupture with dry discharge forming honey colored crust on an erythematous base. So the base is going to be erythematous, but you will find a tiny pustule that is completely having a honey colored discoloration in it. So this is known as impetigo. Eczema. So this is eczema. This will be initially like a pustule and then begins as a vesicles that rupture, creating a circular erythematous lesion with the adherent crusts in it. So this is known as eczema. This is folliculitis. As you see here, this is folliculitis. So inflammation, that opening of the hair follicle that causes erythematous papules and pustules surrounding individual hairs. So that is folliculitis. So under each hair follicle, as you see here, there will be an opening and which is having both a pus in it and a papule, a boil which is raising up from the each hair follicle is known as folliculitis. So can you see here furuncle? Deep-seated inflammatory nodule, which is very deep nodule with pus in center that develops around the hair follicle, which is always painful, that is localized and form an abscess. This is furuncle. Now let's see what is carbuncle. Carbuncle involvement of several adjacent follicles with pus discharging from multiple follicular orifices. There will be a lot of openings in it. See, here is the affected area. Here also it's been affected. So involvement of several adjacent follicles, not only from each single follicle as we saw in folliculitis, but here the involvement of the adjacent follicles will be more. So this is known as carbuncle. Now comes the staphylococcal scalded skin syndrome. Staphylococcal scalded skin syndrome. So staphylococcal scaled skin syndrome. Here, as you see, the staphylococcal syndrome is an infective response occurred due to Staphylococcus aureus. So this is mainly by peeling of the skin, and this affects the infants and young little children and individuals which those who are very much immune suppressed or those who are having renal insufficiency. They will be mostly affected with this staphylococcal scalded skin syndrome. Then comes the cutaneous abscess. Cutaneous abscess is nothing but a localized collection of skin. So what is localized connection of skin? So this is nothing but the cutaneous abscess. This will be always painful, fluctuant, red, tender, and swelling will be present on which there might be a pustule in it. Then comes a cellulitis. Cellulitis is nothing but the erythematous, hot, swollen skin with irregular edges in it. That means which is affecting the deeper dermis and the subcutaneous fat. This is known as cellulitis. As you see here, it is affecting the dermis. Deep dermis is being affected and the subcute fat is also being discolored and affected. This is known as cellulitis. When you touch a patient, there will be a hot feeling over the affected area. Acne. What is acne? Acne is a common problem which all face in day-to-day basis during the teenage. So acne, infection of sebaceous follicles, that is oil plugs, will be because of keratin blocking the sebaceous canal and which results in blackhead. This is known as acne. This is an infection of sebaceous follicles with plugs of keratin blocking the sebaceous canal, resulting in the blackheads. Next comes the streptococcal infection. Streptococcal infection is nothing but IMPETIGO, where the superficial skin will be having a crusting in it and will be affected. So IMPETIGO is a superficial skin infection with crusting or bullae caused by streptococci, staphylococci, or both sometimes. So this is non-bullous. Under non-bullous, it is a superficial skin infection that manifests as clusters of vesicles or pustules that rupture and develop a honey-colored crust. So this is a crust. This is non-bullous. Bullous impetigo is a superficial skin infection that manifests as clusters of vesicles. Can you see a different type of vesicles that is in cluster, in group? So, or pustules that enlarge rapidly to form bullae. The bullae burst and expose large bases. This will burst, as you see here. This will burst and expose to large bases, which become covered with honey-colored varnish or crust. Then eczema. What is eczema? Eczema is a skin infection similar to impetigo, but more deeply invasive, usually caused by the streptococcal infection. Eczema goes through the outer layer, that is the epidermis, to the deeper layer, dermis of the skin, possibly causing scars or leaving behind the scars. This is known as eczema. The last one is the secondary infection. So here in secondary infection, as I told you earlier, this is atopic dermatitis, eczema or atopic dermatitis. So there are multiple causes of this allergic contact dermatitis. Maybe if you wear a ring for a longer period and when you remove your ornament, you will find like this allergic or discoloration of the skin between the finger. So that is known as allergic contact dermatitis due to a contact of a metal. You had gotten allergic contact dermatitis or skin discoloration or skin disease. So this is not a disease. It will again subside by itself once you remove the ornament. So allergic contact dermatitis is an eczematous rash which is developed after contact with an agent to which delayed hypersensitivity has been developed. So I'd like to conclude my topic. There are a lot more skin infections to be discussed. It's primary and secondary causes, and it is more likely like a common cold. So it comes and goes off. The degree of treatment can be varied. If you see a physician even more earlier, then it can be treated. Sometimes if it is sought lately, then it may be or it might be fatal. Hope you understood the topic. Here are some references which I had referred through. Thank you.